Hi, my name is Linnea Davis, and I am making this video about cyclic vomiting syndrome, the rare illness that I have. When you see the bands on my arm, that's because I just left the emergency room and my experience was not too well. Did not like the doctor at Amherst. I think he was new because he was plumb dumb. And when I gave him this pamphlet, he didn't even look at it, didn't even ask any questions, didn't do nothing. Just gave me an IV and sent me the hell on home and told me to call my GI doctor. Now he sucks and I'm very dehydrated, as you can see by my lips. So, what is cyclic vomiting syndrome? CVS is an unexplained disorder caused in children and adults. Doctors do not know why besides migraines and prone to motion sickness. The condition is reoccurring by severe nausea and vomiting, head and abdominal migraines. Some of us vomit. The least is like 5 times. The most I have heard has been up to 30 to 20 times a day. That's sad. The occurrence of CVS, it could begin at any age. It can persist in months, years. I know people that didn't get it till they was 50 years old. Women most likely get CVS more than men or have more side effects than men because of our menstrual cycles. I had a hysterectomy, so I no longer have menstrual cycles. CVS was part of the reason why I had to have a hysterectomy. So like I said in the beginning, people with CVS, including myself, we are prone to motion sickness, migraines, and the symptoms for cyclic vomiting syndrome. Episodes may begin at any time, but some people start in the early mornings. I am one of them. I start about 3 o'clock in the morning. There is unstoppable nausea, vomiting, regurgitating, abdominal pain, migraines, low-grade fevers, diarrhea. Some people get constipated. And we get pale, restless, we need our sleep. We have extreme thirst. The diagnosis, really you can't even really get properly diagnosed if there's no test that's going to come back and say, yes, you have cyclic vomiting syndrome. But you basically have to get tested for everything in the moon and for them to come back to say negative. And then the GI doctor and the neuro doctor and your primary care doctor can sit down and say, yes, you have cyclic vomiting syndrome. There's no blood tests, no x-rays, no specific disorder procedures that can specifically says you have CVS. You literally have to fail every test in the moon. That's sad because I'd have been tested for everything. Our triggers for CVS, some patients known of nothing that triggers attacks. Many identify to bring on certain episodes like colds, flu, infections, too much excitement like birthday parties, holidays, vacations, menstrual periods, chocolate, hot foods, the weather, red meat, whey, diet, the how you say it, dairy, all of them are triggers. Treatment. Treatment is generally supportive, with much importance placed by early intervention. So you need to get into a dark room if you have a migraine, but that don't always work. And you have to go to the hospital when they give you IV fluids and a lot of freaking medicine. I personally take about 10 to 14, 15 pills a day, depending on my episode and how I'm feeling. I know some people that's taking 19 pills a day. The long-term treatment, you have to make sure you have a GI doctor that listens to you, a neuro doctor that listens to you, and your primary care doctor that listens to you, so they can treat you with the right medication. Make sure that you're getting treated properly when you go into the emergency room. Make sure your vital signs is taken care of and you taking your medications on time every day like you're supposed to. Now, a lot of doctors don't even recognize the word CVS. So sometimes you just have to tell them you have abdominal migraines or periodic syndrome, reoccurring vomiting. You have to rename the illness just to get these doctors to understand what is going on with you. And that's pretty sad, because I mean, if they know what cyclic mean or cycling mean, then they should understand that means it's reoccurring. So they know that you have to do something, but they just plumb dumb, I guess. Going to the emergency room is hard. When you go in there, you have to talk to these doctors. You have to show them these pamphlets, show them other papers that you may have. I have a whole stack of stuff that I could show to these doctors, but it gets tiresome, because even if they just take it and do like this and then throw it back down, they're not going to help you. They're not going to try to help you. They're not. They don't care. They don't even want to learn. And that really pisses me off, because then I have to cuss the doctors off. Cuss them out so they can do what they're supposed to do for me. Well, thanks for watching my video. Again, this is Linnea Davis, and I just wanted to tell y'all about cyclic vomiting syndrome, known as CVS.